Well, the title of this workshop is How to Integrate Behavioral Health Clinicians into the Primary Care Office. And it emanates from work that we've done over the past 2 years to integrate our programs, our addiction and mental health services, in with primary medical care. First in a general hospital, which we've been doing for the last year and a half, and more recently, and the subject of this workshop, into primary care practices. So the relevance of this workshop is certainly very current to the way things are moving in our field. And with specific reference to what we want to do in this workshop, we want to talk about how we approach primary care practices, how we sold it to these medical offices, because behavioral health has really been on the sidelines in terms of how they view it. How we selected the clinician to go into the behavioral health office. This is a different way of doing our practice. It requires a particular skill set, which not every behavioral health clinician has. So we'll talk about that. We'll talk about how we adapt it to the PCP office and the pace of activity there. You can't do 45-minute sessions in that office. You need to do brief interventions, and so we'll talk about that. And then we'll also look at some of the assumptions that we had going in about the type of patients that we thought we'd see and what the reality has been. So a little bit about patient profiles, the kinds of interventions we've done, how some of these interventions have produced additional business, if you will, for our specialty behavioral health clinics, and how, in going in with a particular mindset about doing substance abuse and mental health interventions, we've learned that there's a greater role for behavioral health clinicians in a primary medical setting, because now we're doing more chronic disease management. Well, we've trained some of our clinicians to do diabetes prevention education for patients, and are beginning that actually in the next 2 weeks with group trainings. We've also adopted the Stanford Chronic Conditions management program to implement into these services. So we've learned also that doctors are very supportive of this. They see the benefits of it. And so we think it has great relevance for what we're looking forward to in the future of behavioral health and primary medical care. Hope you'll come.